This is a video demonstrating how to administer a sub-Q injection. So the first thing I'm gonna do is I have pulled my supplies. I have my medication here. I'm gonna go ahead and wash my hands before I handle the medication. And I have also pulled the correct syringe that I will need. I'm going to be giving insulin today, so I've chosen a syringe with the orange cap. So I'm gonna go ahead and open up this package. And I'm going to prep the top of the medication vial by cleaning it with alcohol and allowing it to dry completely. Then I'm going to draw back the amount of medication that I'm going to give. I'm going to give 20 units of insulin. And so I've drawn back that much air that I will inject into the vial. So I'm going to go ahead and remove this cap and place it with the opening to the top. And I'm going to inject the needle into the vial and inject the air. Then I'm going to flip it up and pull back the dose of the medication that I need. Now I do have a few little bubbles in there and sometimes that can happen. So I'm gonna squish that out and then I'm going to go ahead and pull back to the amount of the medication that I will give, which is 20 units. You can always go a little bit more and push back up to the dose. There we go. And now I'm going to take this needle out of the vial and recap my needle. And then you can actually leave the needle like this if you want to, but you can also lay it down. It's less precarious that way. So I have prepared the medication. I would take what I need with me to the patient that I have already identified and asked allergies. And I'm gonna go ahead and wash my hands again before I apply my gloves. And now I'm going to clean the site that I have determined that I'm going to give the injection in. I'm gonna clean from the middle out. And I'm going to allow that to dry completely before I give the medication. And I'm not gonna fan over the top of it, and I'm certainly not gonna blow over the top of it. I'm just gonna allow it to dry naturally. And now it is completely dry, so I'm going to give the medication. So now I'm going to hold the syringe by the barrel, not the injector part. And I'm going to discard the cap of the needle because I don't need that anymore. I'm going to pinch for sub-Q, and I'm going to inject the needle at 90 degrees straight into the skin, then move my hand up and inject the medication slowly so that it can be absorbed. And then I'm going to remove, let go of the pinch, and put the needle or the safety over the needle, put it in sharps, and then apply the gauze to the site. The final thing that I'm gonna do is take my gloves off and wash my hands.